Hi everyone, welcome back. It's Nurse Cassie, and today I want to talk to you about pregnancy. I'm going to break it down into each of the trimesters and common symptoms that women experience in each of the trimesters. So let's get started. First, we're going to talk about your first trimester, which usually runs from week 1 until week 12. During this time, your body is going to experience a lot of changes. Common symptoms that you might experience are nausea, sometimes vomiting. You might have smell and food aversions, and this is when you generally feel more of that morning sickness. Although this is more concentrated in the first trimester, you can experience it anytime throughout pregnancy. And then that's because every pregnancy is very different, as well as every woman. So other things that you might experience in this trimester are urinating frequently. You may have PMS-like symptoms, for example, tender breast. You may also have some cramping or achiness in your lower abdomen. Some women experience increased moodiness. Remember that your hormones are shifting and changing as your body develops your beautiful baby. You may also feel fatigued and tired during the first trimester. Your skin can be affected by pregnancy hormones. You may experience that glow up and see improvement, which is amazing, but a lot of times women actually have acne or blemishes from the hormones. Another thing to be on the lookout for is your gums. They become thicker and softer, and they are more prone to infection during pregnancy. So make sure that you're brushing and flossing and seeing your dentist regularly. Okay, let's move on to the second trimester. This trimester is from weeks 13 to 28. This is sometimes known as the honeymoon trimester, and that's because during this time, women tend to feel better and have more energy. There's some exciting things that happen in the second trimester as well. For example, your belly starts to grow. You will start to feel the baby move. This is also the trimester you can find out the baby's gender. Although women are feeling more energetic during this time, you may feel shortness of breath at times because your body is in need of more oxygen. Not only is there an increased need for oxygen, your blood volume increases by 30 to 50% during pregnancy, which causes greater cardiac output. So if you're feeling fatigued and tired from going up those steps, it is because your body is literally working harder. Your sleep may improve because you are no longer needing to wake so frequently at night for the bathroom breaks. Some things that come up during pregnancy at this time are constipation. It's common during pregnancy. I recommend that you eat your fruits, veggies, and fiber, drink plenty of water, and get some light exercise. Heartburn is another common symptom. It may be helpful to stay in an upright position for about 20 minutes to help that food digest. You may want to avoid certain foods if you can tell they're triggering your heartburn. Okay, let's get into the third trimester. This trimester runs from week 20 to 40. You may begin to feel more fatigue and more tired. As your uterus is growing, you probably have a little bit more backaches. You may start to feel more discomfort in general and more pelvic pressure as your baby is growing. Sleeping can definitely become more difficult in this trimester. 3 out of 4 women experience insomnia during their third trimester of pregnancy. My recommendation is that you get some light exercise, maybe a nice walk before bed, warm bath, and lots of pillows. You may start to produce colostrum or milk from your breast. This is totally fine if it happens. You can just wear a breast pad as needed. If you don't experience this, that's also okay. It doesn't mean that you will or won't be able to breastfeed your baby later. During this trimester, you may also experience Braxton Hicks. Braxton Hicks are practice contractions. This is not real labor, but rather your uterus is practicing for labor. So you may have tightness that runs from your back to your stomach, or that is in your stomach only and then releases. Braxton Hicks should be irregular, and although they may be uncomfortable, they should not be painful. So there's my quick overview of the different trimesters. Thank you for listening with me, and I hope that this helps you on your pregnancy journey.